Why won't some children talk? That's a great question, and one that guides me as a speech-language pathologist in my practice. There are several causes of speech and language impairment. Neurological and genetic disorders such as autism, Down syndrome, fetal alcohol syndrome, structural deficits such as cleft palate, hearing loss, and lack of language stimulation. Associated with these causes are some risk factors that I also look for in order to diagnose a child. Every speech and language evaluation I perform begins by understanding the child's health starting at the womb, because speech and language development can be impacted if the fetus is not developed properly. I also look at the mother's health during pregnancy and check for any use of alcohol or drugs, medications, exposure to toxins, and whether there were some complications both during and after birth, such as anoxia, the absence of oxygen in the brain, seizures, and the like. In terms of hearing loss, I want to know about any recurring ear infections because they can create a fluid buildup in the ear that results in fluctuating hearing loss. A child in the early developing years must hear well to be able to absorb all the speech sounds. Last but not least, I want to check if that child is receiving enough language stimulation. I ask how that child, that infant or that young child spends most of his or her day. For example, how much time is spent watching TV, inside a playpen, or in a stroller. I want to know whether that child is participating in play dates with other children, going to the park on a daily basis. In other words, how much language stimulation is he or she receiving throughout the day? Because through everyday experience is how language is acquired. An evaluation by a certified speech-language pathologist can help determine the reason for a delay in speech. Please leave me your comments or questions. Working with children and their family is my passion. I'll be happy to help you.